Welcome to the private room, exclusively for readers of a nurse practitioner's guide to autoimmune medicine, reversing and preventing all autoimmunity. And this is the additional information in the private room to help you become the expert on reversing and preventing chronic autoimmune disease in your community, but also to help yourself and your family reach and maintain optimal health as well. And we're so fortunate to have music therapist extraordinaire Tim Ringgold with us here in the private room. Thanks so much for being with us, Tim.
Thanks for having me. I really appreciate it.
So with Tim's help today, we're going to be discussing what is music therapy. As many of you may not be familiar with using music as therapy, how does music therapy help the brain? How does it help with chronic health? And a little more specifically, how does it help with cortisol? Because as we know, anything that helps cortisol is going to put the body in a much better position to heal from any chronic health issue, including autoimmune disease, and prevent disease. How can patients, the practitioners, and the practitioner's family utilize music in maintaining health, reversing health? And then more specifically, how can patients, practitioner, and family utilize specifically what Tim is doing? So Tim, if you would start, so tell us, what is music therapy, please?
Yeah, thanks, David. Music therapy is, it's a very niche allied health industry. It's the first thing I should say. There's only about 8,000 music therapists nationwide. So oftentimes the name gets thrown around almost like retail therapy. Like, it's just something that people say, they feel better when they go shopping. So music therapy sounds like, yeah, that makes sense. Music is my therapy. But little do a lot of people know that it's really an allied health industry, and where it's basically the targeted use of music by a clinician in a healthcare or educational setting, specifically to impact a non-musical goal. So in music entertainment, we're using music to feel better. The music is, making us, lifting our spirits, right? If we're going to practice music, the goal is to play better music. But in music therapy, it's just the modality that's treating the patient. So very similar to physical therapy, where in physical therapy, the modality in physical therapy is exercise or movement. And you don't need a physical therapist to exercise. But in certain situations with certain diagnoses or conditions, the targeted use of exercise as a modality in the hands of a clinician helps you to repair and restore health and wellness somewhere in your body. And most of us have a pretty good relationship with that. At some point, they've been through PT and I get that. And so music therapy, just imagine the only difference is that now instead of implementing exercise, we're implementing music and the elements of music. And you don't need a music therapist to enjoy music, but sometimes you're going through a certain situation, you have a diagnosis or a condition where the targeted use of music as a modality by a board certified clinician will actually positively impact that condition in many times when no other treatment works, and in other times as a complement to improve the outcomes of other treatment modalities. So oftentimes music therapists work in an interdisciplinary team. We might work with PT or OT or speech in a neurorehabilitative setting. We might work with a pain management team in clinical care in the inpatient or outpatient for oncology, for example. And then we might work as a part of an interdisciplinary educational team on an IEP for clients or kids with, developmental or individual or intellectual disabilities or delays. So oftentimes we're found in a team setting, and we work with clients from, we call it cradle to grave. So music therapy has been shown in research to show positive impacts in very specific situations, from preterm infants all the way to the elderly, to those who are actively dying.
Thank you, Tim. That's fantastic. And I think that speaks volumes as far as the practitioners and as the experts in autoimmune disease, autoimmune medicine, they're going to see 3 months old. They're going to see 3-year-olds. They're going to see 13-year-olds. They're going to see 30, 90-year-olds, including we touched briefly on epigenetics and how when you do therapeutic work, you're changing the genes. You're flipping on the good genes, turning off the bad genes. And if you can do that by age 19, you set the system in a way that keeps them healthier their whole life, even if they leave the home and, you know, make some not so great lifestyle choices. They're still gonna be so much better off than not having done that, but also setting up a genetics before conception so that you're passing cleaner genes on to the next 4 generations.
Yeah.
You know, so you want to make sure you're seeing the young folks, or if you have an adult you see with autoimmune disease, you know, talk to them about this and, you know, see the kids, get them so they don't end up with the autoimmune disease and they pass on cleaner genes the next 4 generations as well. And this is probably a good segue into my next question for you, which would be, so how does music therapy help with the brain, help with chronic health, help with cortisol? We know it helps with epigenetics, but if you can be a little more specific about, you know, that kind of stuff, because we know if anything helps cortisol, it's going to help everything.
Yeah. So a lot of, you know, everybody already knows music's good for their mood and their spirit. That's kind of our lived experience with music. What was fascinating for me going back to school to become a music therapist, you have to complete either a bachelor's, master's, or PhD and the 1,200-hour clinical internship, and then pass a national board certification exam, 100 CEUs every 5 years to maintain your credential. So there's a lot of, you know, clinical education, and there's a particular realm of music therapy that is involved with neuroscience and neurologic music therapy and really understanding music's impact on the brain. And that fascinated me because I felt that I wanted to understand more the physiological effects of music than the, you know, emotional, humanistic, spiritual aspects of music in order to be taken seriously in an allied health field that's very mechanical. So how does music impact the brain? What does it do? And we know that we have this lived experience of it, but what's really happening just that's measurable? And so what we found in research, particularly with active music making, and active music making, David, is just any time that we engage our body in the production of any kind of organized sound that's based on either rhythm or some sort of melody with our voice. So if we can tap, we can snap, we can clap, we can hum, rap, sing, strum, scratch, any way that we engage our body in some sort of musical activity, some really interesting things happen in the brain. The first thing that happens is that it triggers a very, very ancient part of the brain to activate, which is the reward system. So what we find in the nucleus accumbens when we engage in music making is that it releases dopamine. And so dopamine is that reward chemical that is basically involved and linked with motivation and reward. And it's telling us, do this again. You know, like this behavior, yeah, this is really good. You should do this again. And dopamine is designed to be released when we are doing some very fundamental things. So it's very interesting. They studied when you eat sugar, when you have sex, and when you engage in active music making, that same nucleus accumbens releases dopamine in the exact same way in all 3 behaviors. So it shows that it's a very, very, music making is a very primal, very central behavior for the human condition, because as we know, sugar, as we're kind of designed, we're sugar burners. Sex, you know, we're here to procreate and, you know, pass on our genes to our offspring. And music, well, what's that about? What's going on there? Well, music throughout human history has been used as social glue, and human beings being social mammals, the role of connection between humans is vital for survival and ultimately dominance. And music facilitates connection between human beings. So another chemical that the brain releases is oxytocin, which is kind of the hug drug or the love drug, the feeling of being connected to something outside of yourself. When we make music with others, our brain releases oxytocin as well. So it says, do this because this is good, because we feel connected. And then an inverted kind of thing happens where just as the brain turns on the release of dopamine and oxytocin, it turns off the release of cortisol in the adrenals. This was a really fascinating discovery with music, was that music resets the stress response in the nervous system. And from the average person, David, they know they have a nervous system. They remember seeing maybe like a cell diagram in science class, and it was kind of weird. But most of us don't really understand how our nervous system works. And they hear words like stress, and they hear words like relax, but they don't really know what that means in their body and the implications of that. So some of my journey in my studies was understanding what's called polyvagal theory, and understanding that we have this nervous system that basically has 3 gears. We have like a default gear in our nervous system, which is our parasympathetic nervous system, which is the rest and digest nervous system. It is the part of us that's designed to connect and be creative. Activates our prefrontal cortex, which really allows us to think critically and imagine and create things. And then when we perceive a threat, we switch gears into the sympathetic nervous system. And the first stage of that is that fight or flight response, which, most people have heard of that. That mode, though, is more the protect mode rather than connect mode. It's the react rather than create mode. And that's when our adrenals kick in and release, amplified amounts of cortisol into the body to kind of, along with adrenaline, to rev up to fight off that tribe or outrun that lion. And the problem is that our nervous system is so old, it can't keep up with the threats of the 21st century. So we are turning on that stress response chronically now, and we don't understand enough how to turn it off. And the good news is when we make music or we listen to the music that we enjoy, it resets that stress response. So what they found in research was when you make music or you listen to the music you enjoy, your cortisol level drops and your cortisol production drops, which is vital because, as you know, and your readers, I'm sure, are learning, our body doesn't metabolize cortisol very well. It kind of hangs around because it's not meant to be flushed through the system on a regular basis. So what we really need in our modern culture are ways to reset, and ways that don't take a lot of time, because who has time in our fractured, focused attention span, modern, over technologicalized, that's the great word of the day, over technologicalized culture. We don't have a lot of time. So that's where you reach for music. And what we found was that using music can reset the nervous system pretty much faster than any oral medication can, and is probably, along with breath, one of the 2 fastest things that you can do in your day, and you can teach someone to do on their own. You don't need a music therapist to reach for music because you have access to music 24/7. So I can get into like the 3 ways to do that, but that's really what's going on in the brain and in the adrenals during a musical experience. And when people hear that, particularly practitioners, it validates this experience they've all had, which is they've felt better when they listen to music. They know that they've had an experience where they were in a state, a funk, or, they might've been aggravated. They might've been low, right? Maybe too high, too low, over, regulated, under-regulated. And then either their favorite song came on the radio, for those of us who are old enough to remember radio, or they put their favorite music on, and within minutes, their state changed. And they know that happened. But now I give them the language as to why and how that happened, and that it's repeatable and it's reliable. And now they're empowered to be able to reach for that on a regular basis.
Beautiful. Thank you so much. I love the science of everything, and I just find it absolutely fascinating when I talk to somebody who is a scientist, basically, right? And all this, and it's just fascinating the way the body works. It's just great.
It's infinitely complex and endlessly fascinating to me and to a few others, like yourself, right? So some people don't want to be bothered by it, but I am blown away, right? My mind is just by how complex this machine that we have is, and what's happening under the surface of our awareness. It's endlessly fascinating.
And I think a theme that we talk a lot about in the book, and I talk a lot about with patients, is the body is so unbelievably complex, but it is so logical how it
Yes.
works. It is so logical, and we can use that logic, to turn around chronic disease, autoimmune disease.
Yes.
So Tim, how about tell us? So how can patients, the practitioners, and their own family utilize music therapy, kind of day in, day out? And then I'll ask you, please, to kind of tell how people could, access and utilize, specifically what you're doing too.
Sure. So, the nice thing is about music is what I learned working in the hospital was that people had very little access to music therapy. And music therapy is like talk therapy or physical therapy. When you have the presence of a credentialed practitioner working with you, leveraging music as the modality, that's music therapy. Just like when you're doing PT, you're doing exercise, but you're doing it under the supervision of a physical therapist. That's when it becomes physical therapy. But you don't need a physical therapist to do your exercises at home. With music therapy, when you're working with a music therapist, they kind of give you a container of experience, and then you can go off and use music therapeutically every day. And that's really what's powerful, is that when it's 2 a.m., you can reach for music. When it's 2 p.m., you can reach for music. There's only 8,000 music therapists out there. So chances are you're probably not going to have a lot of music therapy in your life, but you can absolutely reach for music to help establish a sense of health and well-being in your day. And there's 3 ways you can really reach for music. The first is you can make it. And when I say make it, I don't mean like go to the music store, buy an instrument, go on YouTube and take lessons. Although you could do that. And if you learned an instrument before and then got busy with career and kids, we all do it. Fine. Pick up that instrument, play something simple. Don't try to play the old repertoire that you learned at the highest point of your musical career. You'll be infinitely depressed by how you've lost your chops. We all get it. You lost your chops. It's not the end of the world. Just because you can't scale Everest anymore, it doesn't mean you don't go for a hike. So that's my first message to those who are listening to me who used to play and have stopped, because I meet a lot of adults who just stopped playing. They're just working all the time. So 10 minutes a day, just play something simple. But for the rest of us mere mortals, listen to the music you already enjoy and try to sing along with it, hum along with it, sing in your head, which is called audiating, or tap along rhythmically, engage your body with the music. Because when you engage your body, David, your focus has to be in the present moment, because music's time-based. So the beat is happening across time. So you have to be very focused in time to be able to engage with music. If you just listen to it, you can go all over the place. You can be zoning out and reminiscing and in the past. That has its place, but oftentimes for a lot of us, we're stressed out because we're too busy worrying about the future or ruminating over the past. So if you want to practice that, where mindfulness is the outcome, not the goal, just engage with music that you're already listening to. Sure, you can make music on your own without any music happening, but just put on music you already like and jam along with it. And don't worry, you don't have to perform music to make music. A lot of us think, oh God, I got to be able to be good enough to be able to play it. No. If you've ever gone to a bowling alley and you've watched people bowl, they don't care how good they are. They just go bowl. So adopt that same kind of mentality with making music and just playing. Just have some fun. As adults, we really struggle with that. We just do everything inside of this work mode. So really get back to play. If you're just like, no way, Tim, no, I'm not going to do it. It's too stressful. I get it. Then what you do is on your phone, you create a power playlist of 3 songs that inspire you, fire you up. When you feel stress strike, you put in your earbuds and you get off the big screen and you go for a walk with your little screen and you put your phone in your pocket, turn on your power playlist, walk to the beat. 9 minutes, the playlist will be over. You'll be back and your nervous system will have reset. And then the third thing you can do is you can relax to it. So there are literally over 2,500 meditation apps currently on iOS and Android platforms. So lots of options for relaxing to music. And what I mean by that is really letting the music dictate your body's ability to slow down and downregulate. And for years, I've been doing that with my clients in inpatient settings, in outpatient settings. And I have a free gift on my website where it's called the Relaxation Vacation, where you can literally just allow slow tempo music. Now, that's important. You want the music to have a perceptible beat so your nervous system can entrain to it and slow down. And then my voice, I take you out of the stress of the present moment back to a time where you felt healthy, safe, connected, and happy. I walk you through that experience so that your brain fires up all of the feelings and the happy chemicals come out just like you were there, because the brain can't tell the difference when you lead it to that spot. And then we bring that emotion and that physical state back to the present, so that you're feeling reset, recharged, and ready to face whatever it is out there. So that you can find as just a free resource. That's over at timringgold.com, which is just the website to find me and find out all the things I'm doing. And then if you're a clinician, we've created a course just for you called Creating Connections Through Music, which shows you, as not a music therapist, but just as a clinician, how you can be using music with your patients and your clients to create further connection, deepen connection, and use it to really help them to stay present, to be able to open up, to be able to be creative, to escape stress in a healthy way, reconnect and relax. And that's just at timringgold.com/connections. You can find out more about that there.
Thank you so much, Tim. That's great. I'm so excited that people are going to know about how to reverse and prevent autoimmune disease, but also this is going to open up an opportunity, I think, for a lot of people to realize there's so many fantastic tools out there, such as music, that can turn around chronic disease. When you get a diagnosis, you're not stuck with it forever.
No.
We kind of like, well, here's a medicine. It's not going to fix it. You're stuck with it. But no, the body can really reset and heal. And I'm so happy that you shared your knowledge about music therapy that our practitioners, their families, and their patients can use. And as I say goodbye today, I want everybody to remember, it's in the book, it's in the song, got a revolution, we got to revolution. Thank you so much.
Thanks again.